open enrollment. And have you made your choices yet? Winnie Sun is a financial advisor, and some folks even call her the wealth whisperer. I like that. She sat down to explain why you need to really take your time when making healthcare choices. And that means don't just autofill what you had from last year. Check this out.
The 2022-23 AFLAC Workforces Report found that half of the American workers surveyed are currently facing burnout. Now, this is a 52% jump from last year. And as you know, this isn't healthy to have in your company. This can impact job satisfaction and loyalty because employees want to know that their employers care about their well-being. The report also found that only less than half of those surveys said that they actually feel confident in their understanding of their health insurance policies and the choices that they're making during the open enrollment period, which is exactly where we're at right now. What really surprised me is how little time people take and devote to researching their benefit options during open enrollment. Most people spend less than 30 minutes on this, which we know is less time than most of us take to plan a vacation. Also, 90% just select what they picked last year. But we know a lot has happened in the last few years, and employees should really take the time to carefully explore their option and what's best for them and their household. The report shows people are struggling emotionally and financially this season. It's important that everyone know that they're not alone. For us, open enrollment is one of the most important times of the year. For households, the decisions you make now will affect you for the entire coming year. These are impactful financial decisions because for many families, healthcare costs make up a big chunk of our budget. So it's important to research your options. You want to have the right coverage you need for when you need it. Whether it be HMO, PPO, or any of the other insurance that you can afford, remember to ask about mental health coverage. It's covered now more than ever. Inflation is the big word of the year, and it's impacting everything from the cost of Thanksgiving to gas to all parts of our budget. And it's had a major impact for many of us on our mental and emotional health. As you know, this affects how people feel, how they show up to work, how they show up at home. In the AFLAC study, they found a whopping 86% of employees who reported high levels of burnout also have suffered other mental health challenges in the past year. We're talking anxiety, depression, trouble sleeping. About half of the workers shared that their personal mental health had negatively impacted their job performance. So insurance companies like AFLAC have taken note and are providing more mental health coverage into their policies. Well, I recently chatted with a friend who told me that the pandemic had taken a toll on her son. He was about to start high school and his mental health was struggling. He needed help. So he did what she needed to do, and she researched and found out none of this would be actually covered in her insurance policy. So this is the thing. Right now, AFLAC has introduced these sort of policies into their products, so it pays to take a look. For more information, check out aflacworkforcesreport.com. And of course, join us on December 7th on the hashtag Winnie Sun tweet chat, where we're going to be talking to AFLAC Senior VP Matthew Owenby.